to home run.
Ouch. Woo. Oh,
Gotcha.
you feel a lot lighter.
Welcome to the office. You're welcome. So you're coming all the way from Seattle.
Yes.
Is that correct?
Yes. Yeah.
And we have a few major issues we need to deal with.
Yes.
Yep. Number one issue is the
Knee and hip.
Started when?
2015.
2015. What happened 2015?
I fell at work.
Okay.
Fell forward, landed on my knee, and in 2015, I worked through the whole year. I didn't feel no pain until April, May in 2016. I start feeling that pain on my knee, and it shoots up to my hip.
So it starts in the knee, left knee, it goes up into your left hip.
Yes.
Do you get back pain in the center as well?
Yes.
Yes.
Really bad.
Okay, and this has been since 2015?
Yes.
Or 2016?
Mm-hmm.
Okay. Now, so from then to now, what are you doing for it?
Nothing. Just, I was going through physical therapy for the hip and knee, and all they said is they can't do anything anymore.
So there were x-rays taken?
Yeah.
Images were taken?
Mm-hmm.
This happened at work?
Yes.
And so you went through the process?
Yes.
You had physical therapy, which was prescribed to you?
Yes.
Was anything broken?
There was nothing broken.
Was anything torn?
No.
So what were you told is your issue then?
They said that there's arthritis.
Okay, so you have arthritis in your knee.
Yes. They said that I have arthritis on my knee.
Okay.
And
but you didn't get arthritis at work.
No.
So you had some arthritis in the knee, you had a fall at work, and it caused you pain later.
Yes.
Got it. I just wanted to be clear.
I didn't know I had arthritis until that fall.
Okay.
So I'm like, when they told me that I have arthritis, I was like, no, I was working. That should have given me some kind of pain, before the fall,
Arthritis?
Yeah.
Well, that's something we can talk about later, okay, in terms of what arthritis is. And it is also used loosely out there in terms of what is it. Arthritis means an inflamed joint, right? Inflammation of a joint. But by the time you see it on an x-ray, when you see the white calcium, that's not arthritis anymore. It's arthrosis, and it's spondylitis or calcium buildup inside the joint, right? Okay. Now, so that's the number one reason you're here.
Yes.
You flew or drove from?
I drove.
That's a long drive, lady.
Yes.
But you have some family with you to help you,
Yeah.
right? Okay. So what we're gonna do today is I'm gonna watch you walk. Okay, after the walk, I wanna go over your x-rays, tell you what I see, and we'll examine you and get started.
All right.
And you ready to laugh?
Yes.
Scream? You ready to laugh, scream,
Yes,
cry, and
I'll
all
do.
the above? Okay, so I will explain through every step of the way.
Okay.
If something doesn't make sense, ask me to explain. If you're not comfortable with something, ask me to stop, please. Okay? Shall we?
Okay.
Now, I gotta mark your dimples, okay? Because everyone has been asking me, where are the dimples, Doc? Like, Doc, where are the dimples? I don't know what you're talking about. And then I did something a little bit funny today, but it's okay, on the other patient. And we're just gonna make a happy face. Okay? Now, I want you to walk several times back and forth, please. And let's just make sure that, so your dimples are actually moving up and down. That's pretty cool. Keep walking. Keep walking several times. So they move up and down, but you can see how the whole thing shifts to one side. And that's about it. You start to get tired. Pain or tired?
It's the hip.
It hurts.
Yeah.
Stuck?
No.
Okay. Have a seat over here, please.
It's not stuck, but it's just that pain.
This is you, okay? This is spine. This is how you've evolved from birth. And we have 24 bones in the spine, 23 discs in between, yeah? And then we have the foundation of the building, which is the pelvis and the sacrum, okay? Okay, I'm gonna zoom into the foundation, and I want us to take a closer look here at the foundation. And what you're complaining of is your left hip.
Yeah.
And the left hip, this is the left hip, this is the right hip. Okay? This is the sacrum, this is the pelvis is here. You can see the right is significantly shorter than the left. It's almost like, so your pelvis is tilting like this, jamming that femur into the acetabulum, into that hip socket. The question is, how long has it been there? That's not 2015, that's a long time. That's a long time ago. But we'll figure it out, okay? But what I'm trying to show you is, first is we do have a severely tilted pelvis, right? We have a pelvis that's tilted. The right side is down, the left side is up. And let's go to the numbers so you can see it a little bit better. And this will make a lot of sense now. Okay, 264, 256, 70, 68. But here's the big thing, 20.4 millimeter leg length discrepancy. So let's talk. Sorry?
That's huge.
Yes. Anything under 7 millimeters, adjustments hold. Anything above 7, we have to see how much we can fix, versus do we have to put in some sort of lift on that side. Now, follow my process. 264, 256, that's the bigger number, right? Now, the way this thing is misaligning, the right side goes down and slightly out.
Wow.
Okay. The sacrum rotates on the left side. So the pelvis wants to go to the left, your foundation. But you have a drop leg of 20, so it wants to bring you right back to that right side. Does that make sense?
Yes.
So you're going one way, and then you're hitting the right, and then you're hitting the left. With that femur being up inside the acetabulum, doing that every day for how many years, things will wear out.
Okay.
Does that make sense?
Yes.
So what we have to figure out is how we're going to get this pelvis balanced. Okay, we have rotation on the left sacrum. We have a pelvis dropped on the right. Okay, which means the left is up. The difference in the numbers here tells me I may be able to correct it, 264, 256, 89, maybe 4 millimeters with an adjustment. But we need what? We need about
a lot more.
14 to 15 millimeters up. Okay? Now, what we'll do today, we're going to examine spine. We're going to examine spine, pelvis. Pelvis means your hip. Hip is connected to that, right? We're going to figure out where we're going to start today. Okay? And then what I will do is we'll send you for the knee x-rays today or tomorrow before the next visit. We'll need to see exactly what's going on inside, and then I can give you a better idea of the knee. Today the focus is the pelvis, the foundation. Okay? Now let's continue, please. Now here's the good news. This is dropped on the right, but it did not produce any curvature issues in your lumbar spine. That's the good news. Okay? As you go up, now I want us to point out a few things. You can see like there's a lot of stress on your bones right now. Okay, so they're almost, instead of being square, they're kind of splaying out like this. Okay, and why I'm showing you that, it tells me there's been a lot of stress on your spine for many years. You see the edges here. This is straight. Look here. This is straight. This is concave, almost like it's squished. So the bone should be a nice, almost like a square, right? Yeah. Yours goes like this, like this, and then it goes like that. Yes. Now, what does that mean? That's nothing for anyone. No one's fixing any of that. That's just telling you you've had a lot of stress on the spine, okay? There's a lot of weight on that right side. And it makes sense now, right? Because the right side is the short leg.
Yeah.
And you've had it for many, many, many years.
So it didn't just happen.
No, it didn't just happen. So look, all your bones are concave
Curve
on the
on the
right
side.
side, on your short side. So, madam, you're standing like this all these years. There's extra weight being put on that side.
I see.
And so that's been developing over the years, and then you had some fall at work and it just exacerbated the condition. Does that make sense?
Yes.
Okay. May I continue, please?
Go ahead.
T2, we have a little bit of a side slip situation. T2, that's something different also. T2 is the upper back. And we have a lateral shift of T2. They typically misalign back. When I see a lateral shift, that was also a trauma, whether it was something hit you from that side, shifted it hard enough, or jolted. Could it have been also from the fall? Possibly. But it was something that made it go like that, this way. Okay? It was
That's probably why I get that pinched nerve.
That's what you feel there?
Yeah, like a pinched nerve above my shoulder.
So that's the area we're going to need to address as well for you, okay? Does that make sense?
Yeah.
Your upper cervical looks beautiful there. Those discs are beautiful, the capsules. Let's go to the side profile and see what we find here. Okay, there it is, right there. Okay, madam. So, your tailbone is here. It goes like this. And then you have that nice nub right there. Do you see that? It should be a smooth arc.
I think I fell on my tailbone somewhat.
We definitely have something down S2, S3. From S2, S3, we have little wedging of L5. 4, 3, 2, those discs are good. Now, you can see here there's calcium, calcium, calcium. Body's trying to fuse the instability. Okay? In the neck, C2, C3, and 4 want to come together also. You see this, right?
Mm-hmm.
Okay. All right? So 2, 3, 4. Now, here's the good news in your neck. Your neck curve is decent. It's pretty nice. I'm happy with that.
It's painful. It hurts.
I understand. I'm just letting you know. You have a decent curve there. Okay. Let's have you stand up and walk again, please. Let's have you walk. Watch your dimples again. So the dimples do go up and down. And we know we have a short right leg, but the pain is on the left. And we know that there's also a drop on the sacrum. So we need to address where we're going to start today. And all of this could be secondary to an upper cervical issue.
Could be.
It could be.
I'm just hoping.
Let's see. First thing, let's just feel the temperature. So, most sensitive skin parts of the skin on the body for checking temperature, back of the palms. Second best place, but we don't do that, is the lips, of course. She's got a lot of heat down here. Okay. And we have a lot of heat here too. Let's take a look and see what we got. Starting at the base of the neck. And the first thing we're getting goes over to C3, C2, but it comes all the way. This is a right atlas 10 points. T2, T3, left side, 6, 7 points. Ten points around T9. 7, 8 points. 10 points. Now I need to get to your sacrum, okay? So I gotta move this apart a little bit. And there it is. Let's start here. There it is, S3, right there. So I'm getting pressure around S3. I'm getting pressure around T9, T10, ma'am. I'm getting pressure at around T2, T3, and I'm getting pressure around C1, right side. Those are 1, 2, 3, 4 spots we're getting. Now, let's go ahead and feel the pelvis. Scoot forward, please. Feet together. Open and close your knees. Open and close. Open and close. Right side only. Left side only. Right side. Left side. So when she does the left, the right wants to go with it. Do the right side, please. When she does the right, I'm feeling it at the sacrum here. Do you feel that, ma'am?
Yeah.
Okay. Now, let's feel between, what is it, L5, S1, 2, or 3, okay? Let's start at 5. This is 5. Okay. S1. S1. S2. S3. You have a high pain threshold, lady. You take a lot of pain, don't you?
Yeah, I did.
Scoot back for me, please. Head down. There it is. C1 on the right, ASRA. Right there. Do you feel that, ma'am?
Yeah.
Head down, please. I do have to poke around a little bit, okay?
Yeah.
Bear with me, please. 7, 1, 2 more tender, 3 more tender. 2 more tender, 3 more tender.
3.
6, 9 more tender, 8 more tender. 9 more tender, 10 more tender.
8,
All right, my dear.
I think.
Talk to me.
I felt that. I think everything that you press in,
Yeah.
it's like pinched nerve. Like I
Well,
can't feel the pain that much. It's just it's like pinched nerve every time you.
You can feel what I'm doing.
Yeah,
Right?
but I can feel it.
Okay, sit back for me, please. All the way back. Right there. I'm gonna hold your hair, okay?
Okay.
Back towards me. C7, T1, T2, T3,
Ouch.
T2,
2.
or 3,
2.
2. C1, right, T2, I'm gonna wait on T9, and we're gonna do the sacrum, S3. That's where we're gonna start. Then I'll have you walk, retest, then we'll figure out the next step. Okay?
Alright.
You sure?
Sure.
Let's do it. We're gonna start T2. I want you to see, we're gonna do T2 in the chair. 1, 2. So let's start T2 here. T2 in the chair. T2 as a PLS. There we go. You okay, ma'am? Okay. T2. Bring that chest back. Bring the shoulders back. Hands on your lap, please, dear. Relax the shoulders, though. Just open it up. Good. Good. T2. Home run. Gotcha. Give that a second now. Give it a second. Breathe, breathe. Hold my hand. Your chariot awaits. You sure you're ready? Right? Hold on. Listen. I'll show you how we have to do it. Totally free. So, maybe that's the weight. Thing. You're gonna step and go forward right away. Don't go back to it. So step close to here. Yep, and just lean forward. There you go. Good stuff. I got you, don't worry. All right, that's good. Head down, please. Is that okay for your neck?
Mm-hmm. Yeah.
Is that okay for your neck? Is that okay?
Yeah.
Turn your head to the right side. Let's do the Atlas, ASR. Let's turn the head all the way, please. Nope, we're gonna do that in the chair later. That's okay. Head down, please. Because if we try to get her Atlas on the side, it'll be too much twisting to do the sacrum. You ready, ma'am?
Mm-hmm.
All right. I'm gonna let this bottom piece go in a second. Let's do this. There we go. Okay. Just slide up with me a little bit. Slide forward. That's it. Good. There we go. There we go. This 1, 2, 3. Now we gotta get this power. You need some power in that left hip, right, ma'am?
Mm-hmm. Yes.
Now, my thought process is torquing it counterclockwise to help bring a little bit of that right hip up, okay?
Okay. Oh.
Gotcha. You okay?
Yeah.
Give it a second. I had to surprise you.
Sorry, I had to surprise you.
Here, let me give you the stick. Have a seat. You okay there?
Yeah.
Can you stand up and walk once for me, please? Let me know if anything is different without the stick.
Oh. Feel lighter.
Keep walking.
Now I can't walk.
That's okay. That's okay. A little bit. It's a little different, right?
Yeah.
Okay. Let's see. A little different. There we go. Sit back for me, please. All the way back. Let's go ahead and do the Atlas C1 ASR.
Oh.
Home run. Give that a second, okay? Deep breathing. In through your nose, out through your mouth. Deep breathing. Now, stand up fast. Use your cane if you need it. Cool. Walk. Check out what the Atlas just did for you. Now, the only thing different from the previous walk is I adjusted your C1, your Atlas.
Okay.
Tell me what's different.
My whole top, I feel a lot lighter.
Okay. Walk one more time and have a seat, please.
walk a little easier, but I still have that.
Sure. Have a seat over here, please. Now with you, I am going to suggest the socks for her, okay? I am going to suggest a pair of socks that I use, and it's going to help a lot. But before I get into that, let's get the ears.
Woo!
Sit up straight, please. Lady, your ear popped louder than some people's cervicals, yo. Sounds good. That's going to help
What
your
is the ear for?
balance,
Oh.
listening to your doctor. That was a joke. There are 3 bones in the ears, incus, malleus, stapes.
Mm.
There was a trivia question in some online game we were playing the other day. What's the smallest bone in the body? So I'm putting it out there. Whoever can answer the smallest bone in the body gets a free adjustment by me. But you have to answer it right now and hit the subscribe button. Bam. Okay. So we were at the right atlas is clear.
Okay.
T2 is clear. I didn't touch T9, but let's see what happened. T9 is clear. Sacrum is clear. Now, feel this. Come back towards me. Tell me the difference. That's 5. S1. S2. Nice.
Nice.
It is, you're feeling it move, right?
Yes.
Good. Muy bueno. Muy bueno. Take your walking stick, please, and walk once back and forth. Tell me.
Amazing.
Different.
A lot different.
Now
A
have
lot better when I first came in.
keep walking with her. Good. I want to make sure she sees. You're bringing that hip up. That knee.
Yeah. But before I drag it,
Walk. Let's see. Sit and stand 5 times, please, on the chair.
oh,
Sit and stand 5 times by yourself. Sit. Stand up, please. Oh, you ain't getting the cane or the walking stick. All right, good. Good, good, good. And take the walking stick and walk 1 time with it. And have a seat. So the technology of the sock is this. It's basically this pattern. This pattern, when you step on it, activates neural points in the, like reflexology points in the foot. It actually decreases back pain and gives you a little more stability in your ankle and more trunk rotation. So you know what it felt like just now.
yeah.
Okay, can we put socks on, please? This is to help you with ankle stability and to help you walk more, because I need you moving, remember? Walk,
Yeah.
no, stand and walk, check it out. It's not about, oh, it feels good, Dr. Rahim just gave me a cool pair of socks. No, dude, feel it.
Oh yeah. Nice and soft.
But more importantly, leave the stick. It's not about the softness of the sock, it's about the stability. Like, put that down. Put the stick down. There you go.
Yeah.
Now watch this. Hold my, just lightly, or actually hold the table. Raise your right leg as high as you can. That's your
the
left
right.
leg. So. And down. And down. Left side.
I like them.
All right, good. Other side, right side. So the sock isn't the fix, the sock helps with your
Stay.
stability, okay? That's where we're gonna start with the
Okay.
question. Squeeze my hand. Squeeze my hand. Elbow, radial head. Nice.
Yeah.
Squeeze. Squeeze.
Oh, shh.
And
Whew.
5 times faster. Squeeze hard. You do feel the difference.
Yeah.
Squeeze hard. Squeeze. Questions? Sure. Welcome
Thank
to
you.
the office.
Thank you.
You're welcome.